Hello, and thank you for joining me today. If you are a woman aged 50 or older, I want you to know that what we are about to discuss may be one of the most important conversations you have this year, especially when it comes to your body, your vitality, and your emotional well-being. My name is Maria. I am a gynecologist with many years of experience caring for women like you. Today we will talk about a topic that has remained in the shadows for far too long: the impact of intimacy, specifically self-intimacy, on women's health in later life. Let me begin with a story. Several months ago, I received a message from the daughter of one of my former patients. Her name was Eleanor. She had always been energetic, perceptive, and full of warmth. One morning, her daughter found her sitting in her favorite chair by the window. The tea on the side table was still warm, her knitting rested on her lap, and sunlight illuminated her face. She looked peaceful, but she had passed away. The official cause of death was natural causes. However, as a physician who had observed Eleanor's gradual decline, I saw something different. Her vitality was not taken by a sudden illness. She slowly and quietly faded due to years of physiological neglect, particularly in the areas of pelvic and emotional health. Eleanor is not alone. Every year, thousands of older women experience a similar quiet decline, not because they are doing something wrong, but because they are directly or indirectly told that they should no longer care for a part of themselves that was once considered essential: their intimate health. For decades, women have been led to believe that desire has an expiration date, that pleasure is something we outgrow. But here is the truth I want you to hear: maintaining a connection with your body through any form of healthy, respectful self-touch that feels comfortable to you is not only natural, it is critically important. This is not about indulgence. It is about preserving blood circulation, hormonal balance, and emotional well-being. When a woman stops all sexual activity, including self-stimulation, especially after menopause, the body does not simply pause. It begins to change. Tissue health, hormone levels, muscle tone, and mood can all decline. The most common thing I hear in my office is, "Why did no one tell me this?" That is why we are here. In this video, I will explain 4 medically recognized consequences of completely discontinuing self-stimulation in later life, and, more importantly, what you can do to help prevent them. These are not theories or trends. They are based on scientific evidence and many years of clinical experience working with thousands of women over the age of 60. Please stay with me until the end. The final point I will share is perhaps the most emotionally significant and the least discussed, and it may help you understand yourself in a new way. If this topic resonates with you, I invite you to like this video, leave a comment below, and subscribe to the channel. We believe women deserve honest, compassionate conversations, especially about aging. Let us begin with the first, often overlooked consequence: the gradual loss of vaginal and clitoral function. I would like you to think about your muscles. What happens when you stop using them for weeks or months? They weaken, lose tone, and atrophy. The same principle applies to pelvic tissues. The vaginal walls and clitoral tissues have a dense network of blood vessels and are highly sensitive, which means they depend on regular blood flow and gentle stimulation to remain healthy. According to the Mayo Clinic and the North American Menopause Society, when these tissues go long periods without arousal, particularly after menopause, they can lose elasticity, become thinner, and produce less natural lubrication. This condition is known as vaginal atrophy. For many women, the first sign is not dryness or obvious discomfort, but a reduction in sensation, loss of pleasure, and sometimes even pain during intimacy, or discomfort while sitting. These are not simply signs of aging, they are physical signals from your body indicating a need for attention and care. I recall a patient, let us call her Carol, who came to see me at the age of 71. She was visibly distressed. She told me she had experienced discomfort down there for many years. When she tried to reconnect with her body, the experience was painful and distressing. She believed something was wrong with her. But Carol was not broken. Her body had simply adapted to lack of use. In the same way that a joint loses mobility without movement, vaginal and clitoral tissues respond to inactivity by becoming less sensitive. The good news is that in many cases, with gradual reintroduction of gentle stimulation, the use of vaginal moisturizers, and in some situations guidance from a pelvic health specialist, sensations can improve, especially when changes are addressed early. What saddened me most about Carol's story was how many years she spent believing this was normal and that she simply had to accept these changes. You do not. Even light, respectful forms of arousal several times a week can promote blood flow, preserve elasticity, and support the health of this important system. It does not need to be complicated. Simple, consistent care can make a meaningful difference. Now let us move on to something even more fundamental to your health, your hormones. Most people associate hormonal changes with menopause, and that is correct. Estrogen, progesterone, and testosterone all change significantly during these years. However, many women do not realize that intimacy, particularly orgasm, can have lasting effects on hormonal balance even decades after menopause. During arousal and release, the brain responds by releasing a combination of hormones and neurotransmitters. Oxytocin, often referred to as the bonding hormone, promotes feelings of calm and connection. Dopamine enhances mood and motivation. Endorphins reduce physical pain and emotional stress. Together, these chemicals create a state of balance and vitality. Now imagine that this cascade has not been activated for years. In my clinical practice, I have seen women who came in with complaints of insomnia, irritability, sadness, or a sense of emotional emptiness. They tried supplements, changed their diets, and even began antidepressant medications. But when we looked more closely at their daily lives, one pattern stood out clearly: a complete absence of intimacy. One woman I will never forget, a former school principal, spoke with a trembling voice and said, "I just don't feel like myself anymore." And the truth is, it was not imagined. Without the natural hormonal reset that arousal can provide, many women experience increased stress, reduced resilience, and even worsening symptoms of depression and anxiety. This does not mean that pleasure is a cure-all. However, it is a powerful, natural support for the brain's chemical balance. And it is never too late to reactivate this pathway. Whether through gentle exploration, mindful intimacy, or personal self-care practices, you have the ability to support your neurochemical well-being. This is not indulgence, it is a medical resource you carry with you every day. In the next section, we will look more closely at how pelvic floor function and emotional resilience are directly connected to the intimate rhythms of your body, and why neglecting them can affect everything from bladder control to your sense of identity. For now, take a moment to reflect. When functioning well, your pelvic floor allows you to control your bladder, maintain healthy bowel function, support good posture, and experience sexual pleasure. When it weakens, everything from independence to self-confidence can be affected. Here is what most people do not realize: regular sexual activity, including self-stimulation, is one of the most natural and effective ways to maintain pelvic floor strength and tone. During orgasm, the pelvic floor contracts rhythmically. This functions like an exercise session. Instead of lifting weights, your body activates these deep stabilizing muscles through natural movement and reflex. When this stimulation disappears, so does the opportunity for these muscles to remain strong. I have treated many women who first came to me because of urinary leakage. Some were in their late 60s, others in their 80s. Many had stopped attending social events, taking long walks, or traveling because they feared not finding a restroom or experiencing embarrassment. They assumed this was simply part of aging. But age is not always the primary cause. The underlying issue is often muscular inactivity. In fact, studies supported by the National Institutes of Health have shown that regular engagement of the pelvic floor, whether through targeted exercises or healthy sexual function, helps reduce the risk of urinary incontinence and even pelvic organ prolapse. Let me tell you about Joan, a kind and energetic 74-year-old woman I treated several years ago. She was sharp, cheerful, and loved doing crossword puzzles, yet she had not left her home for over a month. Why? Because every time she laughed or sneezed, she experienced urinary leakage. After a medical evaluation and a compassionate conversation, we realized her pelvic floor had become significantly weakened. She had not engaged these muscles for years, neither through exercise nor through any form of intimate stimulation, and she had no idea that something so personal could be so directly connected to her everyday freedom. With the help of a personalized program that included pelvic floor exercises, adequate hydration, and the gradual reintroduction of gentle, intimate self-care, Joan regained her confidence. Within a few months, she was once again taking walks with friends and planning a trip to visit her sister in another state. You deserve that same sense of freedom. Maintaining pelvic floor health does not mean following a rigid regimen or doing anything that feels uncomfortable. Rather, it means staying connected to your body in ways that feel safe, respectful, and appropriate for you. This connection is an important part of preserving independence, particularly as we age. Now I would like to move to something even more personal, something I have heard whispered in many private conversations with my patients: the emotional disconnection that can slowly develop when intimacy fades. At first, it is subtle. You stop engaging with your body, perhaps because of discomfort or simply because you believe that those days are behind you. You tell yourself it is normal. Your mother never spoke about these things. Your friends rarely bring them up. And you wonder what difference it would make anyway. Over time, however, this disconnection does not remain confined to one area of life. It begins to affect how you see yourself. Women have shared with me that they no longer feel feminine, that they avoid mirrors not out of vanity, but because something feels missing. They describe feeling invisible in rooms they once filled with their presence. They laugh less freely. They hesitate before reaching out to others. Most importantly, they feel lonely, sometimes even in a home full of people. There is no laboratory test for this, and it does not appear on imaging studies, but its impact is real. Intimacy is far more than physical pleasure. It is closely tied to identity, connection, and vitality. According to the Cleveland Clinic and other leading institutions, regular intimacy, especially when combined with emotional self-care, can help regulate mood, reduce anxiety, and support cognitive function. This is because the brain responds to touch and arousal by releasing neurotransmitters associated with well-being, such as serotonin, which stabilizes mood, and oxytocin, which reduces feelings of isolation. These are not simply a feel-good chemicals, they play a critical role in maintaining emotional resilience and mental clarity. When these signals are absent for long periods, the effects can resemble, or even worsen, depression, particularly in women already experiencing major life transitions such as retirement, the loss of a spouse, or health challenges. Let me share the story of Gloria. She was 69 when she came to see me. Widowed nearly 10 years earlier, she had built a quiet, orderly life. She ate well, walked daily, and volunteered twice a week. Yet emotionally, as she described it, she felt hollow. "I smile for everyone else," she said, "but inside everything feels gray." Gloria had not touched her body for years, not out of shame, but out of habit. She had simply stopped. Together, we worked on restoring a gentle sense of body awareness, beginning not with physical pleasure, but with basic relaxation and emotional self-contact. This included practices such as placing a hand over the heart or engaging in slow, diaphragmatic breathing. Gradually, she began to reconnect. That reconnection did more than improve her emotional state, it reignited a sense of purpose. She returned to art classes, began dressing with more creativity, and even laughed more openly. She told me, "For the first time in many years, I feel like myself again." I share these stories because I want you to understand something essential: intimacy is not indulgence. It is the maintenance of the chemical, physical, and emotional systems that help you feel whole. And you do not need a partner to begin. Gentle self-care practices, whether through breathing exercises, pelvic health exercises, or mindful self-touch, can initiate a quiet but powerful shift in how you experience your body, your days, and your place in the world. We will discuss specific methods and practical strategies you can use to preserve and even restore intimate function in your 60s, 70s, and beyond. These include medically recommended, safe ways to reintroduce stimulation, strengthen the pelvic floor, and support hormonal health without medications. For now, I hope you will take a deep breath, place your hand over your heart, and remember this: you are not finished, you are not broken, and you deserve a life that still has room for pleasure, connection, and joy. Your health is not defined solely by your pulse or cholesterol levels. It is also measured by how deeply you feel alive. Now that we have explored why staying connected to your intimate health is so important, physically, hormonally, and emotionally, let us talk about what you can do about it. Here is the encouraging news: even if months, years, or decades have passed since you engaged in any form of intimate self-care, it is never too late to begin again. The human body, especially the female body, has a remarkable capacity to respond to care and attention, regardless of age. Let us start with the foundation: blood flow. As discussed earlier, vaginal and clitoral tissues are composed of delicate blood vessels and nerve endings. Like your arms or legs, these areas require healthy circulation to remain functional. When these tissues are not stimulated for extended periods, blood flow decreases. Over time, this can lead to thinning, dryness, and even reduced sensitivity. However, there is no need to rush into anything that feels uncomfortable. For many women, the first step is simply gentle reintroduction. This may begin with something as simple as a warm bath, soft music, or the use of a vaginal moisturizer with a balanced pH. Over-the-counter products such as vaginal moisturizers or low-dose vaginal estrogen creams, if approved by your physician, can help support tissue hydration and elasticity. And remember, this is not about pressure, it is about permission. You are allowed to explore your own body with kindness. You are allowed to move slowly. Even placing a hand on your abdomen or heart during deep breathing can, over time, begin to restore a sense of connection. If and when you feel ready, you may begin to explore light touch using your hands or a safe, gentle device designed specifically for older women. Devices with low vibration settings and soft edges are often more comfortable and effective for stimulating blood flow without causing irritation. You may also consider using a water-based lubricant. According to the North American Menopause Society, this can reduce friction and discomfort during self-stimulation, making the experience safer and more comfortable. The key factor is consistency, not intensity. Even engaging with your body once or twice a week can make a meaningful difference in maintaining nerve sensitivity and tissue health. When the body experiences care and attention, the mind often follows. Now let us discuss strengthening the muscles that are not visible but are certainly noticeable when they are not functioning properly: the pelvic floor. These muscles support the bladder, bowel, and uterus. With age, hormonal changes and inactivity can weaken them. The encouraging news is that they respond very well to movement. Kegel exercises are the most widely known and clinically supported method for improving pelvic floor strength. If you are unfamiliar with them, here is a simple way to begin. Imagine you are gently trying to stop the flow of urine midstream. That subtle contraction activates the pelvic floor muscles. Hold the contraction for 3 to 5 seconds, then relax. Aim for 10 repetitions, 3 times a day. If you are unsure whether you are performing the exercise correctly, this is very common. Many women benefit from consulting a pelvic floor physical therapist. These trained professionals can guide you through gentle techniques to engage these muscles safely and effectively, often in combination with breathing exercises and posture correction. As mentioned earlier, orgasm itself causes rhythmic contractions of the pelvic floor. Therefore, when you engage in intimate self-care, you are naturally strengthening these muscles, improving circulation, and supporting bladder control without stepping into a gym. Let us now briefly return to hormonal health. Although estrogen, progesterone, and testosterone naturally decline with age, this does not mean you are powerless. Research published in journals such as Menopause and Climacteric has shown that regular sexual activity, including self-stimulation, supports the body's natural hormonal regulation. This occurs because the brain responds to arousal and orgasm by releasing hormones and neurotransmitters associated with relaxation, bonding, and mood stability. This creates a feedback loop. The more consistently these pathways are activated, the more likely the body is to retain its ability to produce and utilize these beneficial chemicals. For women experiencing chronic anxiety or mood fluctuations, adding even 10 minutes of this form of natural hormonal support a few times per week can have a subtle yet meaningful effect. Beyond biology, there is another benefit that is equally important: a sense of agency and belonging. When you take time to care for your body in this way, you send a message not only to your cells, but also to your inner sense of self. A message that says, I still matter. I still deserve pleasure. I am still at home in my own body. I once worked with a 76-year-old woman named Elena. She had been widowed for 15 years and had not considered any form of self-intimacy since her husband passed away. Her physical health was stable, but she felt emotionally numb and disconnected from her identity as a woman. With gentle encouragement, education, and emotional support, Elena began to slowly re-explore her body. At first, the discomfort was not physical but emotional. She had to work through feelings of guilt, grief, and decades of cultural conditioning. After several weeks, she told me, I didn't realize how much I had missed myself. That single sentence is deeply meaningful. Because this is not only about preventing dysfunction or influencing hormone levels. It is about self-awareness and reconnecting with parts of yourself that may have gone quiet, but are still very much alive. So where can you begin? Here is a simple weekly framework you may consider as a gentle reintroduction. Day 1, 5 minutes of slow breathing with one hand resting on the lower abdomen. Day 2, a warm bath with calming music and mindful touch, without any goal, simply presence. Day 3, Kegel exercises, seated or lying down, 3 sets of 10 repetitions. Day 4, moisturizing the intimate area with a physician-approved product. Day 5, optional gentle self-touch using lubricant or a device, if comfortable. Day 6, rest and reflection, journaling, meditation, or spoken affirmations. Day 7, repeat whichever practice felt most meaningful during the week. Even if you complete only part of this routine, consistency is what matters most. And remember, you do not have to do any of this alone. If you have a partner, a therapist, or a trusted support network, involve them in ways that feel appropriate and respectful. Your health is worth sharing with those who honor it. We will continue by discussing one of the quietest yet most transformative effects of this personal choice, how it influences identity, relationships, and a sense of meaning. Because ultimately, this is not only a medical issue, it is a deeply human one. And you deserve every opportunity to feel alive, both internally and externally. We have discussed biology, hormones, and muscles. We have talked about circulation, mood, and even daily rituals. But as we bring this conversation to a close, I would like to address the deeper meaning behind all of this. Because what is truly at stake here is not only physical health, it is your sense of identity. Too many women aged 50, 60, 70, and beyond begin to quietly feel as though they are fading. Not because they are ill, and not because they have done anything wrong, but because they have let go of something essential, their sense of being alive. Over the past 3 decades, I have sat across from hundreds of women who express some version of this feeling: I no longer know who I am, or, I feel invisible, or simply, I miss myself. When we explore these feelings more deeply, they rarely come down to a medical diagnosis. More often, they are the result of long-term disconnection from pleasure, from confidence, from self-touch, from joy, and from parts of themselves they were taught to suppress once they reached a certain age. This is understandable. For generations, women have been told, directly or indirectly, that intimacy is no longer necessary after menopause, that dignity and restraint matter more than vitality and sensation. I once worked with a woman named Margaret. She was 81 years old. She came to see me not because of pain or illness, but because she felt as though she had disappeared. Her husband had passed away many years earlier, her children were grown, she had a garden, a book club, and a strong circle of friends. Yet, as she put it in her own words, I feel like I only live from the neck up. She was not depressed. She was not unwell. But something was missing, and she knew it. We spoke about body awareness, breathing, and gentle reconnection. For the first time in over 10 years, Margaret began to explore her physical self again, not for a result, not for another person, but as a quiet act of healing. 3 months later, she told me, "Doctor, I don't feel young again, but I feel real again." That moment has stayed with me. Because when a woman reconnects with herself, she does not simply become healthier, she becomes whole. This is not indulgence. It is deeply restorative. It can improve posture, sleep, relationships, and even one's voice. Women who begin caring for themselves in this way often speak more openly, laugh more freely, wear brighter colors again, and carry themselves differently. They meet their own gaze in the mirror. This is not vanity. It is vitality. It is how we return to ourselves. And if intimacy feels distant right now, that is okay. Reconnection is not a race. Every small act of self-respect and self-attention matters. As we conclude this discussion, I hope you feel inspired not only to understand the science of your body, but also to honor the spirit within it. You have the right to feel comfortable in your own skin. You have the right to pleasure that is gentle, respectful, and affirming. You have the right to age not only with physical health, but with warmth and wholeness. If today's conversation touched something within you, if it reminded you of a part of yourself that has been quiet for too long, I hope you allow that part to speak again. Because it is still there. It is still you. If this conversation helped you feel seen, I invite you to share it with a friend, a sister, a daughter, or anyone who may need to hear that it is not too late. Not too late to reconnect. Not too late to feel. Not too late to begin again. Thank you for trusting me with this conversation. Please subscribe to our channel for more thoughtful, evidence-based discussions on women's health after 60. And if this resonated with you, feel free to leave a comment below, sharing your thoughts, your questions, or simply a reminder that you are still here, still growing, and still honoring your body with care. Take care of yourself. You deserve it.